In this video, we'll talk about right-sided ECG, how to monitor this. So the usefulness of the right-sided ECG is to detect right-sided pathology. Right, for example, if a patient is presenting with a right ventricular myocardial infarction, it's very useful to do a right-sided ECG to see the ST segment elevation there. Okay, and actually there are several approaches to recording a right-sided ECG. The comprehensive pattern or the comprehensive approach for this is to obtain it by placing leads from V1 to V6 in a mirror image position on the right side of the chest. That's being said, let's see on this diagram how we can place them. So V1 was on the fourth intercostal space on the right side. With mirroring imaging it will be on the left side, right? So the V1, it will be here. So it's called V1R. R stands for right side. This next lead will be V2R, it will be on the opposite position. The V4 will be on the fourth intercostal space on the right side, with the clavicular line, and V3 between both of them, and V5, V6 on the same places. Okay, this is actually the right-sided ECG, and you have to label this ECG to be a right-sided, so you can have a correct interpretation of the ECG when you know this is a right-sided ECG, not a left-sided ordinary ECG, okay? So again, this is really very useful for detecting right ventricular or right-sided pathologies, and thank you.